Hello, everybody. I wanted to start this session by saying thank you to everybody who signed up for the first ever Reuters Events Investment Roundtable. We're delighted to bring you three incredible thought leaders today in Joel Holsinger, partner and co-head of alternative credit at Ares Management, Adam Heltzer, head of ESG at Ares, and Nicola Gilbert, Path CEO, who's joining us from Sweden. In this difficult moment of pandemic and economic crisis, never has investment outlook been so closely intertwined with global health. By bringing you experts in each of these fields, we hope to unpack this relationship and provide some valuable insight for you all today. Plus, we'll be hearing about ESG and the role that it can play in solving Wall Street's problem of purpose. My name is Marek Razuk, but for now, enough from me. And over to you, Joel, Adam, and Nikolaj. And thank you again, everybody, for being here with us today.
Thank you, Marek. We appreciate it. Well, look, I think we want to keep this relatively informal and cover a number of topics, and we're hoping to hear from many of you who are listening in as we get to the end of this. And so we'll be fielding questions, and Marek will be fielding those questions, and we'll address some of those at the end. But maybe just to start off, we're going to do just a brief introduction of each of us and our background. So, Adam, why don't you start us off?
Great, thanks, Joel. So, again, my name is Adam Heltzer. Excuse me, head of ESG at Ares. And just brief background. I spent the first 10 years of my career in the international development aid space. So I'd say involved in topics like global public health, infrastructure development, agricultural development. And then at a certain point had the epiphany that to make sustainable, lasting change, yes, government intervention was important, but also the businesses actually operating in those environments were also really important. The way that they actually, ran their business and their operations. So I made a switch to the World Economic Forum for a couple of years to work with their agribusiness members. And the idea here is that if they could actually work with those smallholder farmers in those countries, change their practices, they could have a much larger impact on those economies. I think the most recent epiphany was that working with an individual corporate was important, but that really it's through the finance world, through the way that investors actually interact with the companies that they invest in and lend to, that you can really have catalytic system-wide type impact. So recently with the Partners Group and then now with Ares, I've been working with thousands of companies trying to figure out how can we systematically track environmental, social, and governance performance of companies so that we are, as a system, realizing how we can have a better impact on the world.
Thank you. And Nikolaj, why don't you give a little overview both of your own background as well as just a brief set the table as it relates to Path Global Health.
Thanks, Joel, and thanks everyone for joining the call and to Reuters for organizing this. Yeah, I'm Nicola Gilbert. I'm the CEO of Path since January. So I choose a perfect timing to start my new job. Before that, I was working for United Nations. I have also been with Accenture, and I have been a decade in the pharma medical sector with Novo Nordisk as well. And just for those of you who are not familiar with Path, we are a 40-year-old global public health organization based in the US. We are a team of 1,400 people, and we work in around 70 countries around the world. We are an international NGO, and we partner across sectors to really improve public health. And that is within vaccines, diagnostics, devices, many of the things that we're going to talk about today. We are a global team of scientists, engineers, advocates, because we do everything from science to the delivery on the ground. And we are working on fighting some of the worst diseases in the world, and we will also get back to that. Our vision is really around health equity and ensuring that equity is at the front in any global decision and any program that we are making. And especially right now, many of you will follow the discussion on the vaccine access for COVID-19 and how that is going to be equally accessed by everyone. So I will leave it at there for now, and back to you, Joel.
Sure, and I'm Joel Holsinger. I'm co-head of alternative credit at Ares Management. Alternative credit is effectively everything outside of liquid credit or direct lending, so and generally with an asset focus. And so as opposed to being cash flow or EBITDA focused, we're looking and investing across asset focused and have total committed capital of around $10 billion across our alternative credit within the overall $150 billion that Ares Management manages broadly. You know, to tie some of the connections with regards to the panelists today, I sit on the board of Path Global Health and have for the last couple of years, and have supported for, I guess, a little over a decade now. So maybe Nikolaj, back to you, just to kind of set the stage for the audience. Can you start by laying out the global investment landscape for public health and any insights you have into the trends we're seeing right now with real-time and significant global investment in COVID-19, as maybe compared to malaria, HIV, tuberculosis, and some of the other programs you're working with on a more normal basis?
Yeah, that's a great question, Joel, and obviously one that has many dimensions. But really, this crisis that we are facing is really unique in a way that I think all countries are being impacted almost simultaneously. And I mean, not even a world war will be hitting all countries at the same time. And also, what is making this unique is that it's becoming, you know, visible for everyone that there is a strong relation between global health and our global economy. And also the aspects of fear, uncertainty, and how fear is affecting not only public health, but obviously also investment, as many of you are well aware of. And now we are all experiencing this at the same time and going through the cycles of this. But really the financial burden of a disease like this is really nothing new. The difference today is that it's really hitting the developed economies as well as you know, emerging economies. Because the examples of burden of disease is something that we at PATH and many organizations have been seeing for many years. So, for example, in countries where malaria is a epidemic, it's sometimes affecting as much as 25% of the GDP of the country. When we have the Ebola outbreak in 2014 in West Africa, I mean, those countries, Guinea, Liberia, Sierra Leone, they were hit by a 2.2 billion GDP loss, which for those countries were a lot, right? And obviously, we don't know yet the full financial burden of or hit from COVID-19, but we do know already from what is out there that IMF projects a fall of 3% GDP this year, and that this crisis could come up to $9 trillion, and the greatest, which is greater than the economies of Japan and Germany. And then we see the millions of Americans that is now unemployed. We see the same in Europe. So all of this is really affecting everyone around us. And on the investment side, I think there is really no better case. If you were to make the case to invest in global public health, it will probably be an easy business case to make now. It was not so easy to make that case a couple of years ago. So that investment is not really only in corporations that are obviously involved in the response, whatever being it vaccines, diagnostics, devices, but it's really about how do you strengthen national health systems in all countries around the world, because as we can see, infectious diseases, they don't know any borders. And those investments in universal health care are really critical. And we are playing a part of that support at PATH, although not financially, but in welcoming and supporting countries. So we do welcome investments, contributions from organizations on this call. So, I mean, with that perspective, I will maybe also push it back to you, Joel, on maybe on the finance side, if there is anything to add to my comments there. And also, as an investor, how do you invest in this period of uncertainty, really?
No, it's a great question. I mean, I think that that's the thing is, as you know, I like history and I like cycles. And so the more academic part of me likes to look at the way that these play out. And there's a lot of similarities when you're looking at cycles, right? If you look at historical cycles, everybody wants to make comparisons. Everybody wants to compare it to the Great Depression, the global financial crisis, and different pieces. And I think that, you know, it goes to, you know, history does repeat itself. And in general, the rule is it isn't different this time. And I think there's a lot of similarities as you're looking out there with regards to the way the cycles play out. So if you look back at late March, the sheer contagion or forced selling that we saw, that is a normal part of a cycle. That's kind of, as we like to call it, the fire sale section of it. And the unwind of leverage, if you think of cycles at its simplest basis, you know, money makes the world go round, credit makes money go round, right? It drives the valuation of every asset that goes across the globe. And normally the cycles are effectively the expansion and contraction of the multiples of credit as you go through. So those are the similarities. The differences, and you hit on it, Nikolaj, it really goes to, this is different from the standpoint of the overall global impact it's having. I mean, if you even go through the global financial crisis, many of the developing world grew through it from a GDP standpoint. This is a true quarantine, a true shutdown of the global economy. You know, we basically have a global economy that's been hit by a bus. It's been in the hospital for a few months, and we don't know what's going to happen when it comes back out. You know, you don't just go and run a marathon after you've been laid up in the hospital for 2 or 3 months. And that's effectively true with most of the global economy. And so there's uncertainty as it relates to not only how long of a bridge do we need. So when you're looking at any particular investment, whether it be across equities or across credit or across anything, from an investor standpoint, you're left with this uncertainty of how long does the bridge need to be? Just as importantly, what does the other side of the bridge look like? I think that's the most important question. If you think of, you know, unemployment numbers in the US as an example, the question isn't whether we're going to peak out or 20 or 25. The question is, what are we going to be at the end of 2021? Is it going to be 7%, 10%, 13%? And so with companies, when you're looking at the bridge to the other side and trying to figure out what those earnings are, you then also have to go back to that multiple. You have to go back to valuation, right? You have to say, what are the earnings going to be on a price per earnings? What are the multiple of EBITDA going to be? And that part is different. I think the advantage we have, especially from an alternative credit standpoint, so as I said in our beginning, and everything we do is asset focused. The advantage we have is you generally have large diversified pools. So assets are generally loans, receivables, or leases, and they're diversified and they're uncorrelated. So it allows you to go forward. And as much as it's hard to make an investment on single name type risks at times on individual companies or individual situations, it's easier to say, what is this pool going to look like? Let me go run draconian scenarios across a large pool and see how that performs. And it's really the only way you can kind of move forward and advance. You know, you can use the playbook, and we know how to advance on the playbook, but the certainty you get in a lot of ways is from that diversification and from those uncorrelated underlying assets. And so it's very interesting times to be an investor, no matter what asset class you're looking at. But I think that the market right now is a false recovery, because I think the underlying pain, as you mentioned, the $7-8 trillion, I think the question of where this ends and what the ultimate results are real. There's real losses occurring from companies, from countries, and those losses are true destruction of net worth, right? On a global net worth basis. They don't just go and get filled back in. They're a hole that's there, and we have to deal with in some form or fashion, whether it be at a corporate level, an individual consumer level, or at a government level. And I think the ripple effects that are going to come out of this are going to be seen through. I mean, Adam, you are an interesting from the standpoint of, as you covered in your background earlier, it's an interesting background. I remember when we originally met, there's not many people that have kind of bridged across working both on the global health side, as well as World Economic Forum, as well as on the investor side. As you're kind of looking at that bridge between the global health and USAID and World Economic Forum and others, and also the investing world with your current role from an Ares standpoint, what can firms and companies do better to align their business goals with their purpose, their ESG or charitable or other goals in this kind of uncertain time?
Yeah, it's a great question, Joel, and I think as we reflect on one of the major impacts of COVID, one of them is that the cultural core of a company, the center of a company, at least for the foreseeable future, is not going to be the office. It's not going to be the physical commons of a company. And so what we're seeing in our portfolio and elsewhere around the world is that there's an even greater desire for a sense of mission and purpose at a given company. Because if you're going to be recruiting and onboarding people remotely, and maybe having a remote work schedule and so on, or a partial hybrid remote work schedule, a sense of connection among colleagues that really focuses on what is our company's role in society, and how do we use that as a unifying force is an incredibly important thing that I think will differentiate between companies that succeed in this post-COVID world and those that languish a bit. I think to your point, the core question then is how do we actually do that? And in my world, the role that I play at Ares, and many of my colleagues do across other companies, there are tools that make this practice much easier to implement. And I'll just share a couple ideas. One of them is this topic of materiality. And the idea here is that there's such an overwhelming and wide universe of possible ESG or sustainability topics that a company could focus on. So how do you go about narrowing that enormous universe down to the subset, a manageable subset that you actually should be working on and focusing on? It should be part of your culture. And a lot of people have thought about this, and so there's some good guidance about how to go about doing this. One is to figure out who are your key stakeholders. Many folks on the call know about the news item from late last year, which was the Business Roundtable saying the new form of capitalism is a stakeholder capitalism. What that means is that there are a number of groups, constituencies, that either impact a business or are directly impacted by a business. Think of your customers, think of your employees, think of your suppliers, think of your investors. And so you have to ask yourself, by actually engaging with those groups, what ESG topics are most important to you? You then cross-reference that information with what ESG topics are most relevant to my business operations. Number one, what am I in a position to directly impact? And number two, what topics actually have the ability to directly impact my own success? And if you sort of weave those things together, you begin to arrive at a manageable set of, call it 5 to 10 topics out of this broad universe that really a company should focus on. At Ares, this is the process that we do. We look at a wide range of diverse companies, and we have to figure out, okay, for this business, this is what's most relevant and most material. Last thing that I'll touch on this topic of materiality is a group called the Sustainability Accounting Standards Board, or SASB. And this is a group that is promoting that subset of 10 to 15 topics that for a given industry, call it healthcare, call it consumer, call it services or industrials, what the most likely topics are. I can tell you that from Ares' perspective, we're a financial services business generically. And so the material ESG topics for us are number one, do we integrate ESG into our investment process? Because of course, that's where we have an outsized impact on the world. But more inwardly looking, how do we handle our human capital? How do we develop people? How do we ensure inclusion, diversity in our workforce? So we do our own mapping of most material topics and make sure that we are systematically addressing them ourselves. I think, to tie it into the broader conversation, to kick it back to you, Nikolaj, one of the amazing revelations of this whole experience is that public health is now a material topic for most companies, right? And so I'm just curious to hear from you. We've all read and heard a lot about COVID-19, timelines for vaccine, tests, therapies, how it impacts business. We know that you're on the front lines of this through PATH. You're working with WHO, you're working with CDC that we read about in the headlines every day. So could you just sort of share your insights about this real-time global response, what you think's working well, what's not, and just give us a sense about how you expect this to play out in the broader economy over the coming months?
Yeah, thanks a lot. And there are many angles to tackle that question as well. But I would start that a global response, it's to call it a coordinated global response would probably be an overstatement. So I think this pandemic, which many have named as the mother of public health crisis, it hits us also in a given time, right? It's a time of a lot of geopolitical tension, which affects the way the world is responding. It's hitting us in a moment where there is a general lack of trust and lack of coordinated response to many of the global challenges, also beyond health. And all of this is making it a bit harder, I would say. But really to focus a bit on the positive side here, there is, despite all these challenges, there is really, I am not sure that I've seen an example of where the global science community has worked and come together so much as they have in the last couple of months. I mean, sharing information that before would be highly, highly confidential across public sector, private sector, academic institutions, private companies, social sectors. That is really new, and it's that kind of approach that is also affecting how fast we will come through this together, because there is a better likelihood of success when we have more than 100 vaccine candidates than if we had 10. And so the fact that these different organizations sharing information of what is working and what is not is really actually helping us accelerate that response. And it's not only in vaccine development, it's also happening in diagnostics, in therapeutics, in protection equipment, and so forth. And we at PATH, we are actually also working on a vaccine together with Baylor College. We're working on tests, scaling up oxygen, developing protective equipment. And all of that is also happening in that partnership mindset and spirit, which is the one that I believe is the future. So that integrated model that we're using right now, it should really be the default in the future. And maybe that is going to be the new normal. We don't know. But another aspect, which I'm sure you're all following, is the Johns Hopkins dashboard, how that gives us data, gives us information of what's going on. And today, I mean, we have around 5 million infections globally. And what is really leading into that data, that you could say consolidated number, is really local systems, public healthcare workers, community healthcare workers, that is really providing that data in a transparent way. It's not perfect, but it's those who we have to thank about that data. And just before the world closed down, I was able to go to Democratic Republic of Congo, DRC, to see how they were responding and how we are working together with them on Emergency Operations Center, which was actually designed for outbreaks like cholera, measles, which they have in the country. They have many challenges. So when COVID really was starting to emerge, how they were able to switch those resources and systems to actually support that. That was really great to see an example from a country which is a fragile country with a lot of challenges. The last thing that I wanted to share is that what might happen, obviously we read a lot of what's going on in emerging markets, Sub-Saharan Africa, Southeast Asia. There is a lot of predictions, but what is The most certain is that we don't know, right? It's too early, it's too risky to make a lot of predictions. And some people have forecasted this development and it happened to go in the completely different direction. So, and actually some emerging markets with experience in these disease outbreaks have come out on top because they have a lot of, resources, epidemic expertise, and so forth. So some of those bright spots are Vietnam, Senegal, and so we will have to continue to look for inspiration of which countries are dealing with the crisis in the best way. But what I do think is that those countries where there is a lot of political will, a lot of trust, a lot of investment in public health, that actually affects a country's ability to respond. And the good thing is that when this pandemic shift the epicenter from Europe or from China, from Europe to US, and now to Latin America, there are lessons learned along the way, and hopefully those will be applied. So it's a big topic, and there is a lot to say, but I will turn it back to you a bit, Adam, now on the ESG before COVID. So how do you what do you see is going to change in the ESG response and how it's being integrated into corporations with this post-COVID-19 scenario?
It's a great question, Adam, because I think you run into this scenario where everybody is very in favor of ESG until it starts affecting their returns, right? And so maybe kind of give a little commentary as it relates to that, as the performance through, and how you think that it will come out the other side of this.
Yeah, it's been a really interesting progression to observe over the last few months. And in a way, I think it really mirrors how unpredictable the pandemic itself has sort of unfolded over the last few months as well. So the early reactions were exactly that, Joel. It was companies are fighting for their lives. And so ESG, as an extracurricular, must fall by the wayside, right? And it's interesting because what we observed was actually the opposite. Number one, you have major companies and brands that are racing to demonstrate that they are good corporate citizens, right? Just turn on your television at night, watch the commercial breaks between shows, listen to the soft piano music, right? Slow images of families take care of themselves. And I don't say it to sound cynical. What I observe is that anyone from Frito-Lay to Amazon to Target, and just count them up, is racing to demonstrate not just through a marketing lens what they're doing, but they're also ponying up real commitments and saying, hey, here's what we're doing to kind of assure you, consumer, or other kind of stakeholder, that we are acting as responsible citizens. Because I think management teams understand there is a sinner versus saint narrative going on at this very moment, and they know what side that they want to be, cast as. So that's one major trend that I think really goes in the face of, hey, it's now deprioritized or an extracurricular. The other, which is much more tangible, and at Aries we're living this and seeing it on the front lines. It's the fact that some ESG topics are now number one on the agenda. So we invest in many different ways. Joel, you laid out just one through your team. We also invest, we're also a private equity investor. We take control positions in companies. And so we have a great deal of influence, a great deal of control over the operations of those businesses. Once COVID spiked, we began a weekly portfolio-wide call. We had the CEOs of all of our companies join to understand the latest developments on the public health side, on the regulatory side, the policy and politics side, and so on. Not surprisingly, we have spent an enormous amount of time, including deep dive sessions, on one of the greatest ESG topics, health and safety. And we do that not just because it's the right thing to do, but because if you want a quicker path back to revenue, of course you need to take care of the health and safety of your employees. Of course you have to take care of the health and safety of your customers. We all know in the pits of our stomach as consumers, we're not going to a restaurant where we don't feel safe. We're not going to patronize another kind of store if the employees are not wearing masks, and so on. And so what I've observed is that, quite contrary to being deprioritized, we're finding that especially many social topics are actually surging up the agenda. The same thing that I've said about health and safety, you could also observe about supply chains. Wow, look at what we've observed through the supply chain strains in this crisis, and companies waking up to saying, shoot, we need to understand who our suppliers are, where they come from, have backup plans, make sure they're upholding their own kinds of standards. Business continuity planning, which is considered a major topic under the G of ESG. Very clear to see those who did a good job doing business continuity planning before COVID were much better off than those who did not. The list goes on. Employee engagement and human capital, how we treat our employees is increasingly important, and so on. So clearly, for me, ESG is very high up the agenda. And on the corporate citizen side, I think it really is important. I think management teams understand that employees and customers are staring at them. They're staring at them and waiting to judge. And so, deciding what is the ideal type of company that we want to be. And when I spoke to our portfolio companies, I said, many of you have mission statements, many of you have value statements. Now is the time to uphold them, right? If ever there was a test to say that we actually stand by these values as a firm, now is the time to actually come through with that. And I can say, at least on Ares' part, we spent a lot of time talking about our own values and our own mission, our own purpose. And so for us, we have donated substantial, meaningful amounts of money to the COVID relief effort. We focused our giving in the cities where we operate, so Los Angeles, London, New York, donating large sums of money to the hospital systems locally to make sure that they are prepared for the crisis. PATH as well. We partnered with PATH on their programs. Also a relief fund for our portfolio companies. We have a lot of companies whose employees are suffering, so a good chunk of the money that we've given to the effort goes directly to the portfolio companies that we work with in the frontline employees. So, just one example of how it can be done, but for me, I'm experiencing and observing a surge in interest on ESG.
Nikolaj, maybe you want to share just a little bit as it relates to some of the public-private partnerships, not just what Ares has done with PATH, but also maybe some of the broader and how you see that role going forward.
Yeah, thanks, Joel. Thanks. And I think Adam said a lot, right? I mean, we have been talking about customer loyalty, and now I think employee loyalty is also going to be. It's going to be interesting to see post COVID-19 how the best minds of the world and where they want to work. I think that's going to be interesting. Obviously, those companies who has taken this seriously will have, as you said, really displayed that it's not just words in those statements. And I think that's really the test here. And hopefully those companies that are taking this very seriously, like Ares, are going to come out on top of this. And obviously this way of working is our model. And it's interesting to see the difference in mindset also from a country to country, where there is maybe stronger public-private partnership and trusts between government and private sector, maybe in a geography that I come from, which is the Nordic countries, than maybe in other parts of the world. But I do think that those, cultural differences is probably gonna become less, because we have now seen that the value of actually addressing challenges when they hit a country together, bringing those expertise in, has really proven its worth in this moment, that the government cannot respond to this without the private sector, and the private sector cannot respond to this without the government. And so it really is glued together. And that also speaks to the work that we're doing at PATH, which is about partnership. So we don't have obviously all the answers. So when we are working on digital aspects, we're working with Tableau, with Microsoft and other organizations. When we do vaccine development. We work with GSK and others, Merck and so forth. We are working with some of the most leaders in terms of the NGO and foundations like the Gates Foundation, and really trying to bring all the benefits and all the strengths from these organizations together. So that's our approach, and I think that's also going to be the future. And I hope that those who doubted before will really come across the line now. And that actually leads me to the question I wanted to ask to you, Joel, because it's interesting that your passion for global health and how that has evolved over the years, and you have personally also supported global health and PATH. Where does this interest come from, and what has is there anything that you have seen changed in the ecosystem in global health over your time, your 10 years, when you have looked into this subject?
Yeah, look, I would say I came from very, very humble beginnings. That helps. When you come from little, you want to find a way to give back. And I've been very lucky and successful from that standpoint. But I'd say it's a lot of credit to obviously the family, not only my parents, but as well as my grandparents, on being very charitable themselves, even with little. And my dad, to his credit, still travels to South Sudan and has traveled to Ukraine when they opened up, in India and other things back in the 1970s. So I would say, seeing, from an investor standpoint, global health to me was always the best investment, right? If you're going to give back, there's nowhere your dollar goes further than global health. There's lots of great charities and great causes, and I'm about as big of an animal lover as you can get. But in the end, when there's still people, there's still people dying and having senseless deaths, then, human lives have to have priorities over other lives. And so as much as there's great colleges and great foundations and great other ways you can give back, from a global health standpoint, there's very little other things you can do where you're going to get as much impact on your dollars, not only because it's people are dying in poor countries that wouldn't be dying in rich countries, but also from a global health standpoint, your dollar goes further. Your purchasing power is larger as you get into those countries. And so for me, it was just more the logic of it. And then it was a function of trying to research where you get the biggest impact. And I think I kind of stumbled across PATH, as you know, Nikolaj, a decade ago, partly due to reading some of the Bill and Melinda Gates Foundation, partly due to Charity Navigator, which is a great resource for people if they're looking to kind of look at various charities. But I also knew you needed scale. Kind of like investing, your most effective comes from scale. So there's a lot of great small organizations, but to really drive innovation, you need scale. And to really get the most effectiveness in country, you need that. And so, PATH is one of the ones I've always supported. They touch about 350 million lives a year, which is pretty crazy when you think of 1,400 employees and the size of the organization. But it goes to, that combination of scale and that combination of innovation. Global health, the main thing to your question that's kind of really changed in my mind is, I'd be the first to say that when I started supporting global health a decade ago, I saw it more as this a story of pain, a story of things gone bad, a story of things that needed to be fixed. And I think what's really changed through my work with PATH, as well as UNICEF and some other organizations, is what you see is it's really a story of hope. The problem in global health is not a problem of solutions broadly. It's a problem of capital. We know generally how to save lives with the different vaccination programs, and the progress we've made on malaria and tuberculosis and polio eradication and other programs, Ebola and things, is really amazing. And if you look at global health broadly, I'm going to get this stat wrong, but it's something like 120, 130 million lives have been saved since 1990 on just the reduction of child mortality. If for those out there, if you want to have a good investing book as well as global health book, Hans Rosling's Factfulness is a great book on statistics as well as global health, and frankly, I think a really good investing book. And I think it speaks to that story of hope. I think that the progress that's being made, people would be amazed on what's being done. And I think that the same amount of money that if it was your next door neighbor, if you could help them and save their lives, you would clearly do that. Well, the reality in global health is you're not saving a life, you're saving potentially thousands and 10,000 of lives. We know how to do it. We know how to go through and do that. So I think that it was really always kind of more that type of background that led me to it. And I think that, and it's the same thing, if you think of tying these worlds in, it's the question of, we all like to work on the right platform. But the real key is, can you tie in the right purpose, right, across what you're doing, not just the platform and who you work for. And as was mentioned on our Aries management earnings call, one of the things I'm proud of, and I think Aries should be very proud of, is Aries has allocated at least 10% of the performance fees from a recent fund to global health and global education charities, above and beyond some of the programs tied directly to COVID-19 that Adam said. So to be able to kind of, invest the way I like to invest and be aligned with an organization that has that kind of purpose, it really combined those pieces. But I think that as those are out there, you grew up in the Sally Struthers and people that were dying and starving in Africa and other countries. People are generally not starving unless they're in war-torn countries. The problems we have today is that capital problem and that solutions problem. So it's really bringing that home that's probably changed my opinion in the last decade or so, and travel with PATH and with other organizations to Southeast Asia and to Kenya and to India. You can't travel to those countries and see the impact being made and the people and the lives and not have that impact you on a broader way. Maybe from a timing standpoint. Sorry, go ahead, Adam.
No. If it's a timing question, I'd say I'll hold my question, but I did want to link it back to Nikolaj with a follow-up question. But if you think it's time to skip, that's fine too.
Oh no, I was going to say maybe to all of us, and Adam, will start with you, as it relates to what we think the new normal is, in your role, and then I'll ask the same to you, Nikolaj. So as we get to the other side of this, and we're all, I get to shave, and we end quarantine, and we're back in our offices, and we're doing this at conferences as opposed to video streams. When you're looking at that new normal, how do you think that new normal will impact your job on a day-to-day basis, Adam?
Right. So similar to your shaving, Joel, I think the new normal is that I get a haircut. So looking forward to that. No, it dovetails with my comments earlier about the surge in certain ESG topics. So the new normal, I think, for us is we again interact with hundreds, actually more like thousands of companies in a given year. And so, Aries being a sharp investor, we now understand how important these topics are to see in those companies when we evaluate them before investment, during a holding or ownership period, how we want to ensure strong performance on these topics. So I think the new normal is exactly those things I mentioned before. Does the company have a sense of mission and meaning and purpose that brings the culture together? Is the company adequately addressing those health and safety topics that are such a key determinant of financial business success? So for me, I think the new normal is ESG topics as just an ever more integral part of the toolkit to evaluate companies, to own them, to lend to them. And my expectation is that the new normal means that this just becomes an ever more integrated part of the way that people invest and the way that our economy runs.
Sure. And Nikolaj, what about you from a new normal?
Yeah, a new normal, which is actually already a normal today, is that you have in every single news briefing or television, you have public health as a topic. So, I mean, our jobs, which has maybe before our focus has been, a niche or something that we did as an NGO, is suddenly, frontline headlines. And that brings good things with it, because it has brought in a lot of new actors, investors, people who want to contribute. So I think that whole aspect of the private sector, which I talked to before, that is a new normal. We are seeing companies with ESG, strong ESG principles, rapidly lead up on product development, manufacturing, supply chain, developing vaccines for good, make them affordable, make sure they are equal access to everyone. So that's really a new normal, this generosity that we are seeing. And I really hope that also a new more normal would be, we will be seeing that in terms of a better preparation for another pandemic as we learn from this, but also that we need to continue to make progress on other diseases like HIV, TB, malaria, because those are actually hit. And there are more people dying now from other diseases than COVID-19 because they're not receiving treatments or not followed up. So that is also what I hope is that focus will also be included in a more broader aspect. And then finally, the equity part of it, that health needs to be more equitable, and that's a global good for everyone to enjoy.
Yeah, and I'd say, look, from an investing standpoint, I think that we were already in a world where the demographics had shifted underneath our feet in a way that we didn't necessarily realize. And I think that, you know, where basically the majority of the developed world was already flat to shrinking from a population growth standpoint, across this, it was already shrinking across Eastern Europe and Southern Europe, already shrinking in Japan and China and Russia. And I think the impact, you know, as China goes from 1.3 billion to 1 billion, they lose more people than the US has by the end of the century. We were already going towards a period of, you know, the running large budget deficits on a country basis was going to create issues. So I think the new normal now is really a period of deflation and hyperinflation. I think there'll be parts of the world that are in a deflationary type of a cycle because of those demographics, as well as the high debt to GDP burdens, as well as the lower growth portion, unless there's larger than expected productivity growth. And then there'll be other parts of the world that unfortunately will probably be in hyperinflation because the reaction that you go through this. So I think as you go forward, that will probably lead to you know, in your deflationary countries especially, there'll be a feeling of public equities probably trading sideways to down for long time periods, as you've seen in Japan and other countries, which means you end up having more of a chase to yield or credit or other types of assets. So I think that was already coming, but when you go from running a $1 trillion deficit, which was already mind-boggling in the US, to running a $4 trillion deficit in a single year, and you're already at, I think it was 22 trillion today. Those are large increases that I think just kind of bring some of those things on a more forward basis and change things. And I think that ability to earn and that ability to save is different than it was kind of coming into this, and it's just brought everything forward 5 to 10 years from where we were. I'm going to open up, Merrick, just to open it up. I have a couple follow-up questions I want to ask at the very end if we have time, especially the magic question, Nikolaj, on COVID-19 specifically. But Merrick, maybe I'll open it up to any questions from before we go to that.
Great. Can you hear me?
Yes.
Okay, excellent. Yeah, we did get a few questions. I think the first one is for Joel. So, Joel, you mentioned that we were currently seeing a false recovery in global markets at the beginning of the webinar. Could you expand on that, please?
I think that if you look at the headlines today and you see the economic numbers and you see obviously, you know, going over 20% unemployment in the US, you see the shutdown in the economy. And I think if you see China being the best estimate of what recovery looks like, that recovery is a long recovery. You know, you're seeing in most of your consumer facing types of businesses in China that they started off at 30 to 40% of what they were at before. They've climbed up to 70% type of a range. We don't know whether that ends at 80 or ends at 90, but I thought The Economist did a great publication about 3 weeks ago. It's called the 90% economy. Well, we don't even know if it's a 90% economy. I think on the other side of this, on the other side of the bridge, there is going to be longer term impacts, especially prior to any, you know, the combination of all of the skills and all the things that go into this, from the data integration that Nikolaj talked about to the antiviral testing, to effectively the longer term only real full solution, which is probably a vaccination program. Until we've gotten to that new normal and we've gotten to the other side of this, I think the impacts and the losses that are there are not being reflected in the market, especially in the liquid side. You're seeing it more reflected in the illiquid parts of the market. But on the liquid portions, you know, your average recession is a 40% drawdown. And we're in a recession, and we're in the worst recession we've seen And I think it's going to end up being a worse recession than the last recession on broad numbers. So to think that the market is treating that as a 15% down and trading at a forward multiple of earnings on public equities to levels that are 1999, that's not reflective. But I think that's honestly, history tells us that you have these false rallies and you end up going through other periods of this. And I think as people wake up to the third quarter and the fourth quarter and the impacts of this, because as much as there's been a huge response by governments, there's going to be a large amount of people that are not going to go back to work and businesses that are not going to reopen. And we don't know those numbers yet, but those numbers are going to be significant. And I think that impact on the real economy has to eventually roll through to public equities and liquid markets and broader asset markets. And I think that's what I mean by the kind of false recovery.
Great. Adam, Nikolaj, do you have anything to add to that?
I think Joel covered it well.
Yep.
Excellent, excellent. There was another question for Nikolaj. Have you encountered any models that predict coronavirus's effect on GDP in the developing world? I know that you mentioned that. Mostly we've seen COVID play out in the developed world. Besides what's happening in Latin America at the moment, is there a reason that we're not seeing huge coronavirus-related crises across the developing world right now?
Yeah, that's a good question, and obviously one that has many aspects to cover. But I think that I haven't seen any modeling on. Obviously, when IMF does modeling, they do it on a global scale. So when they say minus 3% this year, it's of course the whole world, and then they break it down by region. So there are models available on GDP growth, including China, India, and so forth. So those models, they exist. And so that was the first part of the question. Obviously, some of those countries are less connected into the world economy, so it might be of a less contraction in sub-Saharan Africa, for example, than an economy like the US or Germany with a lot of export, where the demand and the supply side is hit at the same time. So obviously, maybe the impact will be smaller. But the problem with those economies, and you know that well, is that the investors, we are seeing a pullback from investing in those countries, and we're even seeing that the remittances that people send back, migrant workers to those economies, are also going down because people who work in the Middle East, who are from India or Philippines, are sending less money back. So that actually is having quite a large impact on those economies as well, and the sustainability of those. In terms of the more public health aspects of this, obviously I'm not a you could say a public health expert, but what some of the theories that are out there is that there is a younger population in Africa, which is the reason why there is not so much of a toll there. But in truth, we don't know because the data is lacking. There's also a theory on that many of the people who were affected having other chronic conditions, and those are less in some of those markets, including India, with a young population as well. So there are a lot of theories out there, and I think that we will have to see how it evolves.
Great, thank you. Difficult question, definitely. We've only got 6 minutes left, so I want to open the floor back to you, Joel.
Sure. So I would end it with the hardest question, Nikolaj, which is the question everybody wants to know, just to put you on the spot, which is, with the combination of tools we have, what is your best guess with regards to when there is the new normal, when we are to the other side where people feel safe to kind of go out and kind of be normal again from an economic activity across the globe? Is that what's the month and year of that on your best guess as you say here today? Not to put you on the
Well,
spot.
if I could answer that question, I would be, I would probably work for, I don't know. But it's a great question, Joe. And I think the answer will be phased as well. So we can see that in Europe already now, that some countries are coming well out of the pandemic. We have seen contractions in spending of around 25% in the Nordics in these periods of time. But now the cases is looking pretty good, so the economies are starting to open up. But the real question is, will people start spending again, which you touched upon? Will people start traveling? Will they, start, the engagement in activities again? And for that to happen, obviously, a vaccine is going to be critical. And you have all seen the timelines of 18 months, which is, very, very ambitious still compared to normal timelines. We have good news on therapeutics now, remdesivir, which seems to be able to have a strong effect as well in terms of treating people with symptoms before they come into tubing and so forth and intensive care. So there are signs that there are now that the science will solve some of these issues for us and will bring us back to normal. But it is also about trust and trust in each other, trust between countries, that it's safely to open up again. So yeah, that's the best I can do, Joel.
What I didn't hear a month or a year.
I didn't hear a month and a year.
I think you talked about everything but a month or a year in that answer, just to be clear. So, yeah, this is your Nikolaj only opinion. Are we a vaccination that can be rolled out in scale? Is that March of next year, June of next year, September of next year? What is your best guesstimate?
Yeah, I think it's probably going to be available next year. I don't believe in this year, although some people do. Next year, and then it's all a matter of who gets the access first, who gets access to the vaccines. Probably we know the answer for that. And then there's the whole aspects of rolling that out to the rest of the world. So we will start to see, I think, normality towards the end of next year. And then 2022, more countries are going to get access to the vaccine, and there will be manufacturing. So 2022, I think, will be a good year.
I think actually, to end on a positive note, I know it's hard to say this when hundreds of thousands of lives have passed and we've gone through this, but I do think, to Nikolaj's earlier comment with regards to a lot of the walls have come down. We've gone to an open source sharing of information across countries, across organizations, or to use the Obama quote of, never waste a good crisis. I think the positive that will come out of this is that we'll be so much better prepared for other types of global health issues, where, as bad as it's been, I think Nikolaj would agree, it could have been a lot worse, right? With regards to the roll through here. And I think that the reaction going forward, people will be dramatically better at attacking these on the front end and shutting down the spread of these, which will hopefully help us if we ever run into anything similar in the future. And I think not only will it help for pandemic type of issues, but I think will also help with other types of global health issues and that awareness that will come out of this. So I think that, as well as just a broader sense of purpose and relates to ESG, I think that is the positive that comes out of all of this crisis.
Yeah, we are all epidemiologists now.
Yeah, I think you're right. And just to say one word is that the insurance premium and investing in pandemic preparedness is a good investment now. And I think the world has seen that. So probably we will be in a much better place if it comes back.
Well, thank you, everybody, for those who are listening in and along, and we appreciate Merrick for setting this up, and thank you, Adam and Nikolaj, for participating. I'll throw it back to you, Merrick.
Of course. I just wanted to say that I got a question via email in
Sure.
the last 2 minutes. If you guys have another couple of minutes, let me just pull this out. So, question for Joel on this call from Stephen. How to catalyze private sector impact investment that directly positively impacts emerging market, public health, or ESG generally? And then what is the role for the public, multilateral sectors to incentivize this? Can this happen now, or do we need a political shift in the US and other investor nations for this to occur?
I think it goes back to the tie-in of the platform and purpose I mentioned earlier. I think that it's up to the private sector to do a better job, frankly, to make sure that there's an alignment. And I think that the good side is the next generation, the younger generation, not to age the three of us up here, excluding you, Merritt. I think the millennials and my own children who are in kind of the Z generation, I think that you already see the impact and the desire for tie-ins for purpose in even anything they do in the private sector. So I think that that is happening as we speak, and it kind of goes to, as I mentioned earlier, some of the tie-ins we have from an ARI standpoint on support of some of these programs, as well as the tie-ins on some of the charitable portions. And I think that's really the key. I think in the end, look, I'm still a private sector guy broadly. And so I believe the solutions will almost always come broadly more from the private sector. And what history has shown is that they come in periods of need, right? You know, in the end, whether it be on energy or environmental or on global health, I think that to quote Will Durant from Lessons from History, it's a great book. You know, he said, man advances, right? Man adapts and man advances. And I think what's been proven over history and time is that we are up for it. And I do think that as people come together and work together on these issues, we'll tackle them. Unfortunately, sometimes it takes a crisis for that to occur. And most of the greatest advancements that have occurred in science over time, if you think about it from Walter Isaacson's The Innovator book, you know, the greatest advances in time have come from, unfortunately, war, as well as, or if you think in computer science, NASA and the race to which really came out of the Cold War. I think that those types of things occur because of a necessity. And I think that as you're looking forward, I think having tie-ins for companies where you know, Wall Street especially has a bad reputation and a lot of it earned, but it has that problem for purpose, right? If you're just out there for that last dollar, it doesn't really drive home and it doesn't accomplish the goal of being able to do what you love and being able to make a good living, but also have that purpose. And I think that going forward, those types of economic tie-ins to support, because, you know, I remember I was asked, well, why don't you just do social impact investing? And I'd be the first to say, I don't know anything about social impact investing. And I do know how to invest, and to be able to have a derivative or be tied to an organization that gives back in those programs, I think that's the key. Everybody needs to do their part when you're in that situation. And if you can tie in those direct incentives, whether it be corporates with a, you know, direct profits interest tie-in to foundations, or whether it be funds with a direct promote tie-in to that portion, I think those are the steps to fixing that tie-in. And I'd say, you know, I was inspired a long time ago by one of the Home Depot founders when he was speaking at the conference, Bernie Marcus. He spoke about you have to hold nonprofits accountable, right? The reason I got involved in the board of PATH, the reason I got involved in others, is you can't just give, you have to give like you invest. You have to make sure that there's accountability at that level to make sure that those programs are being rolled out and being done in an effective way. So I think the combination of those things leads to those solutions. And I think that we're making very good inroads. I'd say, you know, to Adam and ESG, where we were 5 years ago, where it was a buzzword, where it is today, where it has a reality and has real impact, has been a pretty meaningful change in a very short time period. And I think you're going to see things like that, things like tie-in the global health and the organizations. I think you'll see that going forward.
Thank you so much for coming and joining this webinar today, everybody who's been watching us, and thank you to you, Nikolaj, Adam, Joel. I appreciate you coming here today, digitally at least. And yeah, hopefully we can do this again soon. Thank you very much.
Thanks,
very
everyone.
much.
Have a great day.
Cheers.
Thanks.